stretched. And we have expanded the number of locations where people are being detained. We have also identified Omicron cases in the community. If you recall, I said when we did the last sequencing, we saw about 7 cases among the community samples. There's an increased availability of vaccines, especially in the last 4 weeks, and over 6.6 million doses of people have been administered across the country, and this is what has been documented. And as we all know, adherence to protocol is still very low, and there is some level of vaccine hesitancy, that people are a bit more, some reluctant to take the vaccine. So the total confirmed cases, which is the usual, is about 132,000 now. We've done over 2 million tests. About 1.29 out of the 132,000 have recovered. We have recorded 2,259 deaths. And as I said, our active cases as at the 13th, as at the 14th, 1,301. Severe cases remain 18, has reduced from 22 to 18, and still there's no critical case. I'm sure our journalists are getting very familiar with this usual epic curve now. It took us many years to learn it, but COVID has allowed all of us to understand. We can see that we have seen 3 waves. If you see the last end, you can see that the graph started showing up, and so we all have to be very, very careful. You can see that it's chopped up. And if you look at the next slide, which is the active cases, next slide, you can also see that active cases are also started showing. Yes, there's a highlight there. Click again, sir. So you can see that even the active cases are also having, the nose is up now and started rising. So we are really not in good times, and we will know that this is much higher than what we had last year. And if you saw what we went through last year, it's not. But I think we have more armory now to fight it, and that's why there's a need to intensify some of the benefits we have now to be able to avert more cases and deaths. Next slide. I think so. When you look at all this, you can see that the moving average, that is the average number of cases in a week, as it moves, is about. It's also going up. It's also rising, and so it's not as if nothing is happening. When you look at the cases, this is just a Greater Accra. You can see that as of the 14th, even though we don't have any critical case, the numbers of people on admission has moved from 114 to 207. So that's another indication that we are not really in very good time at all. But the next slide just told us, ever since we started testing at the airport, we have seen about 3,613 positives. And this last few months and weeks have really contributed significantly what we are having. Next slide. So if you go into details, you can see that these are the daily distribution of cases at the airport, and you can see that there's a spike. There's an increasing number of cases. And this obviously is going to be a reflection in the community, because that tells you the threat we are facing. And we also, like we keep on saying, that there may be people who may be incubating, and so they will not be picked. And so they could also come in and spread. That's why the new measures have come in to ensure that we reduce that risk of people who are incubating and who are likely to be positive significantly. Next slide. Yes. So you can say that what we got in January, when we said we were in a major challenge of deaths, we are already seeing that in December. As of December, I've done 484, but the whole of December last year was 393, thereabouts. And so you can see that this is just half, middle of December. So even if you project as double, it means that we are looking at about 800 positives at the airport in December. So what's the rationale for the mandatory vaccination, if you want to use that word? Because we have increasing numbers of cases among travelers. The surges combination waves have been predicted in increased cases among arrival of travelers. We have a significant proportion of the population who are unvaccinated. And so if you have done about 6.6, or even let's round up to 7 million because we're still updating our data, it means that about 23 million Ghanaians are unvaccinated. And that includes people who don't even qualify to be vaccinated, because that you can't do anything about. We are also vulnerable to that. Some persons who test positive on arrival may be incubating, as I said, disease and potentially get into the community and spread. We also have an anticipated high number of activities at the Christmas season, as we have seen all the activities, the parties, the planned parties, etc., and even the New Year celebration of crossovers and all those things. These are all major threats that we need to start looking at. I am particularly very worried about crossover, or whatever name. Increased availability of vaccines in Ghana is an opportunity that we need to ensure that once we have vaccines, and it's a major tool to fight, why don't you ensure as many people are vaccinated as possible? So far, about 6.6 million people have been vaccinated, and total dose. And if you go to the majority of them are AstraZeneca, and we have the other Johnson & Johnson being the least. Next slide. But in all this, you can see that about those who have total admissions that administered is 6.6. But in December, we have already done, as at the time, as a collation we are now, barring any other ones that has to be keyed in, we have done about 1 million plus doses this half month. The differences just show, this table shows vaccine receipt updates. We have so far received about 1 million doses already. Next slide. And you can see that in the last 1 week, we have received 9 million doses of vaccines. And so we really must take advantage of this availability and ensure that we all are vaccinated. So, next slide. So based on that, we are still looking at our vaccination strategy. We've already discussed the visions with you. And we are also saying that the delivery strategy is virtually taking the vaccine to the people. And that is why we are going to schools. That's why we're going to workplaces, churches, mosques, and markets, lorry parks, sports stadia, and house to house, and every district and every region, based on their peculiar situation, devises a strategy that allows them to reach the people, while we also intensify communication to also avert all these If you want to come to Ghana, you must be fully vaccinated if you are non-Ghanaian. And also the issue of vaccination of unvaccinated Ghanaians and residents arriving at the Kotoka International Airport. That says that if, because you are a Ghanaian, within that window that has been given, you could travel in, but you'll be offered a vaccination. Drive and general population, both community engagement and some multimedia approaches. Oh, I didn't notice. So what are the measures, the details of the measures at the airport? All persons 18 years and above arriving in Ghana will be required to provide evidence of full vaccination for a COVID-19 vaccine at the point of embarkment, which means that if you are coming to Ghana, you have to prove that you are fully vaccinated. And what is our definition of fully vaccinated? Is a person who is said to be who has taken the full dose, the full doses, as is 1 or 2, depending on the type, approved and registered by the Food and Drugs Authority of Ghana. We have also added that those who have acquired WHO approved listing, approval, that is EUA, that is a listing, to also as part of the team. But if you are somebody who took that, once you arrive, because you have not had a vaccine registered in Ghana, you will be offered the vaccine to take in addition. All unvaccinated Ghanaians and residents who are currently outside the country and intend to return within 14 days, and here that's about 28th of December, they will, however, be vaccinated on arrival. So that's the listen. This is also to ensure that the rest of us are all protected. There are other measures that we want to use in averting the surge post-Christmas, because Christmas will be the incubation period. Then after the party, that is when things come in. So we are encouraging all persons who intend to access indoor events to get vaccinated. Event organizers and facility managers are encouraged, or should encourage persons to get vaccinated. Okay? Outdoor events in open air spaces are encouraged as much as possible, and such locations include sports stadia, football parks, outdoor events and centers are all areas that we want to encourage. The capacity for indoor events must not go beyond 25% of the existing capacity of that facility to ensure social distancing. We all know that indoor areas is the place where the spread is highest. And we are also made our teams ready, that all those organizers that should actually invite a team to come and assist them in the setting to make sure it is safe. We already always have this, all COVID protocols to be observed. But that's just in writing. When you go there, nothing is getting observed. Now we want to be part of the team that set up the place to ensure that exit, entrance, spacing, etc. is appropriately done and also maintained to ensure that we really mean that all COVID protocols are being observed. Why are we promoting some mandates? The aim is to protect the residents of this country from COVID-19 and also prevent the fourth wave from coming into Ghana, or at least reducing the impact of the fourth wave should it come. And I can think we can see a little rise already. Also, avert the high cost of managing COVID-19 and provide, cases and provide opportunity for investing in other sectors. And as you are aware, the effective date of that vaccination will be made by the minister somewhere in January, as you already mentioned. So who will be affected? I mean, as we speak now, this could change. Persons who will be affected are all health workers who should be vaccinated. We have already done assessments. You know the proportion of health workers who are not vaccinated, and they are all been alerted that they have to get vaccinated. All security personnel should be vaccinated. All staff and students in secondary and tertiary schools should be vaccinated. All government workers or those working in government institutions and parastatals are affected, and all commercial drivers are affected. And to encourage that, that's why we are providing vaccines. As of yesterday, all the taxi drivers and airport drivers are being offered the vaccines to ensure that by the time it comes up, they are all, because they are also at risk. If you see this 484, for those who come in, they are the people who are going to carry them. And so that is one area that we are looking at. There are venues that will be affected. These are the nightclubs, beaches, sports stadiums, restaurants, and government offices and hospitals. These are areas that are likely to be affected. Not because if you are a patient, you can go there, but this is more like the people who work there who have to be ensured that they are protected. So in summary, our outlook is that we have an increase in cases in the last 1 week. There's a sharp rise of cases among international travelers. Pending Christmas festivities and current trend and imported cases have implications for potential fourth wave, and there's a need to intensify surveillance and enforcement of protocols and vaccination to avert a possible fourth wave and its attendance challenges. Thank you very much.
Thank you, Doc, for the brilliant presentation. I will only plead with the media that in times like this, we can only count on you to assist us spread the good news. Because of misinformation, a lot of conspiracies out there may be discouraging Ghanaians who are at risk of infection not to go and get vaccinated. But with your kind assistance, we will be able to reach even those in the most remote areas to go and get vaccinated. And the issue about vaccines not being available is also untrue. The vaccines are there. Tell people to walk to the nearest district hospitals and other identified centers so that they can get vaccinated. And when each and every one of us get vaccinated, we can all be safe, so that we can assist the Ghana Health Service and also our hard-working health professionals to go to work safely and come back to us as their family safely. Thank you. On that note, I will call on you if you have any question or any submission. Kindly show by hand. We'll bring the microphone to you, and then you can ask your questions, and we'll go to Dr. Patrick Kumar-Boaji for his responses. Let me also acknowledge the presence of Dr. Ebo Hammond, who is the Director of Health Administration and Support Services at the Ghana Health Service. So please, if you have any question, kindly show by hand and we'll bring the microphone to you. Okay. So we'll take the two at the back.
Good afternoon. My name is Kojo Asman. I work with City FM and City TV. Yesterday, the President indicated that in parts of the Volta region, people are refusing to be inoculated because when they receive the jabs, they may vote for a certain political party. I believe Dr. Patrick Kumar-Boaji has heard this. His men are on the ground. What measures have they put in place to erase this cynical arguments being made at that part of the country? Thank you.
Okay, thank you. So we'll take the next question from the left wing.
I am Nana Kwadwo Opon from TV Africa. And my question is about news that has been circulating that the Ministry of Health and government has put in place measures to curb this COVID-19, and which includes making the vaccination compulsory for every citizen. that would hinder certain opportunities, including the entry to public places. And I want to find out if, from what he said, it's more of an encouragement to citizens. So is it actually true as it's going to be compulsory, or it's just an encouragement? Thank you.
Okay, thank you. So we'll take 3 more questions if there are any. If not, we'll go to Doc for his responses. Okay, we'll take the 3rd question from the left wing. Okay.
Right. My name is Lodi Dwasari with Media General. So there's a video going around about a student of the University of Ghana ranting about someone taking the vaccine and then dying days afterwards. I want to know if the ministry has seen or heard anything about it and what the issue is.
Okay, please, to set the tone on the matter of politics, I think the president was categorical. He stated 2 things. The vaccines are safe, you won't die. And the second thing is that the vaccine has no control over your power of choice or your ability to exercise judgment or discretion. So that being said, I'll yield the podium to Dr. Patrick Kumabwaji for his responses.
Thank you very much. The first question on the measures being taken to remove cynical. I think there is a lot of misinformation going on. There are a lot of people circulating all manner of videos and cutting and pasting and creating all kinds of, and sometimes some of these people who are already vaccinated. So we continue to engage the communities, share the facts with them. We share the importance of the vaccine, and that's exactly what we have done in Volta region. Yes, not only Volta region has some hesitancy. There are some communities, some places where we have some level of hesitancy, but we continue to engage. We're engaging with the chiefs, their MPs, etc., to also be part of that. I agree that the MPs have been very helpful in trying to also abet and provide further information to ensure. We saw some increase in uptake in November. We hope that the same will go on in this Christmas and the same in this December, and that's the same going for other places. Like we keep saying, the vaccine has 3 benefits. The first one is that the fact that you get transmission, you get infected, is low. The second is that you are not likely to be admitted. That means you are not likely to fall sick. And of course, if you are not likely to fall sick, they are not likely to die. And we have global information about it. We also have local information proved to show that if you look at the number of people who are in ICUs, etc., they are all unvaccinated. The majority of the people who were admitted, the last time we did an assessment again, is 98% were unvaccinated. The people who are coming to the airport who test positive, 75% are unvaccinated. So that is very clear that it's beneficial. I don't know whether there is, I would say, what you call the word compulsory vaccination. I don't know, it may get there. There is nothing now that talks about compulsory vaccination. We are saying that if you are a health worker like me and you are not vaccinated and the mandate is assessed, you cannot come to work. So it's your choice whether you want to resign from your work or take the vaccine. So it's not compulsory. So I think that's the way we should put it. If we say you can't go to stadium if you are not vaccinated and you want to go to the stadium, get vaccinated. So you are not saying it's compulsory. But in public health, there are times can be compulsory, but we haven't reached there yet. The mandatory condition that tells you if you are this person, you need to be vaccinated to be able to go here. If you want to enter this particular venue, you need to be vaccinated. If you don't want to go there, it's your choice. So it's really not meant. Yes, we have adverse events of vaccination, and that's So far, I think we have done a lot of four autopsies? Yeah, 24 or something. Yeah, 26 about adverse event, not necessarily death. And so far, we are yet to really see anyone that can directly be linked to that. There are many things that will kill you. You have one who was diabetic, who had what we call diabetic acidosis, which is a very critical level of, a very, very major complication for diabetes. But the fact that you took vaccine a day or two earlier does not necessarily mean that is what. But because it's a vaccine, we'll take our time to do full assessment, including autopsy, to identify the cause of death. Okay, and I'm sure there's a process of that particular, I think it's a case in Koforidua, which is currently going through the same process to ascertain the cause of death. We have some information. Of course, we are not at liberty to put that in the public here, but we go through the full process and establish causality. And that's what we do for all cases. That's why we have the app that you can apply, you can report on. If you have any adverse event, go to the hospital and report the nearest facility. Even pharmacy shops are being trained to take that information so that they can also report. It's very important for us because all vaccines here under emergency use authorization, so that information collection is extremely important. So I think that's why we want people to know that one, there is that association. We go through the full processes and identify what it is. But so far, the vaccines have remained very safe and effective. Thank you.
Please, if anyone has a follow-up question, we will take it, but if not, then we'll call it a day. Any questions? Okay.
All right. So since the aviation guidelines began on Tuesday, what has been the progress and the gaps, and how many people have been vaccinated at the airport?
Since the aviation guidelines came out on Tuesday, okay. Please, any questions? Okay, then we take that as the last question. And we'll go to Doc for his response.
Thank you very much. And you'll be amazed at the enthusiasm with which people are taking the vaccine. It was supposed to be on the 12th, but to give the airlines enough time to prepare, we shifted to the 14th. Even on the 12th, about 100 plus people got vaccinated, even though it was not affected. But because we had the stand there, a lot of Ghanaians who had arrived took the vaccine. We'll continue, we'll give you an update. We don't have the numbers now. This happens during the night, especially in the evenings when more people come. So we will continue giving you an update, but that'll be part of the total vaccination that is being given. And I can assure you that a lot of people are very, very enthusiastic in looking and taking the vaccine. Thank you very much.
On that note, I would like to thank Dr. Patrick Kumar Boaji, directors and staff of the Ghana Health Service who have joined us this afternoon, and to thank the media for always giving us the coverage and educating Ghanaians. Thank you and have a good afternoon.